You have a sick child, you may be one of the many people having trouble getting medicine, even if you go to the hospital.
And that's because there's a big supply problem for antibiotics and popular over-the-counter drugs. So what can you do? Here to help us sort that out is Dr. Arun Chopra. He is the director of pediatric critical care at NYU Langone's Hassenfeld Children's Hospital. Good morning, doctor.
Good morning.
How are you? Yeah, welcome, doctor. First of all, tell us how the drug shortage is impacting your work.
So this, unfortunately, is something we've been dealing with for a bunch of years now. I think the first FDA sort of report on this went back to 2018. So there are medicines that go on short supply. Usually we can manage that by being judicious with our use. Very rarely have we ever run out of anything, but we've come close with a few things in the hospital. What I think a lot of people will see in the pharmacies is sometimes they go to get something and they're out at the time that they get it. Some of the things that we've seen out in the pharmacies, Tylenol was one of the things that's been on short supply on and off. Some of the over-the-counter antibiotics have been on short supply, and there's a couple things you can do. One is shop around. Some of the smaller pharmacies may still have stock in place. And the other thing to do is look for alternatives. So if it's Tylenol that you're short on, if your child is over 6 months of age, you can use Advil or Motrin, excuse me, to do the pain control or fever control. And if it's an antibiotic, talk with your pediatrician because there are options that they can prescribe.
I hate to bring you back, but you said that this has been a problem since 2018. So I'm assuming that this confluence of the flu, RSV, COVID, that's just exacerbating the problem?
Yeah, so we actually see it with Tamiflu every year. It can be on short supply by the end of the flu season. Excuse me. Yeah, we've been seeing shortages for many years now, and it's a confluence of a bunch of things with limited suppliers, market forces, and really the resilience of things. And with some of the things that we see impacting, even as simple as storms impacting certain areas, may take distribution site. Yeah.
Yeah, now a lot of people get a little confused too about the use of generics as opposed to, other forms of drugs. I mean, is there really that much of a difference in the generics?
So prescription medications that are generic are very, very similar and can be used really interchangeably for almost all situations. There's a few very rare seizure disorders and things where very specific modulations of the medicine might matter, but using generics is totally okay with things like acetaminophen or ibuprofen. Tylenol and Motrin are the brand names that people will think of, but generics totally work. And then, if you're using acetaminophen for fever, really fever, if anything, is not dangerous. It is actually helps us fight infection, but it makes you feel lousy. And in fact, if you think about what you do when you have a fever, you bundle yourself up in a warm blanket because you feel better. And so letting kids do that can actually help a lot.
Oh, all right, good idea. And the last bullet point that was up there is to remind parents, having a fever isn't usually dangerous, right?
That's correct. Yeah. So fevers with infections is a normal reaction, and the reason we get them is it helps fight infection. They're very, very, very rare cases of children that can have seizures induced by fever, and those are extremely rare and generally self-limited. But for most kids, the only reason to treat fever is comfort. And so do the things that make you comfortable. Lay comfortably, dress warmly if you're feeling cold, and lots and lots of fluids.
But what is the threshold then for a parent? If the kid's temperature is 104, still not going down, when do you go to the doctor or go to the ER or urgent care?
So I think if you have a fever that's persistent more than a couple of days or for an unknown reason, that's something that you may want to see your doctor. If your kid has a cold, obviously has a cold and has a fever, there really isn't a number specifically that's going to be dangerous from that if your child is otherwise healthy.
Doctor, with Christmas and New Year's coming up, I mean, are these illnesses going to get more common, and are we looking at possibly getting back to wearing masks again when we're in, indoor public places?
I think that's a personal choice. We still wear them in the hospital, and I don't see a time in the near future where we're going to stop. So when I'm not in my office behind a closed door, I'm wearing a mask. It is an effective way of protecting yourself from some of these colds. I think the likelihood of us going with a mask mandate is exceedingly low. And I think people are going to have to make their own choices. I think, as you're gathering, understand who you're gathering with, bring people into the home if you're sick, and ask people if they're sick to maybe not come.
Good words of advice. Dr.
Yeah.
Arun Chopra, thank you again for being with us this morning.
Happy to be here. Thanks.
Yeah, have a happy and healthy holiday.
Yes.
Same to you all.
All right, thanks.